so thank you for coming. I'm going to talk, my name is Traci Cucinotta. I live in Winthrop. I am a social worker. I've worked in hospitals as a medical social worker. I also have education and a degree in bioethics, which primarily means working with really complicated issues in medicine, and primarily for me, it's end-of-life issues. I currently am working at Boston Medical Center as a part of their palliative care team, helping to educate people on the importance of having advanced directives, which is exactly what I'm going to talk about here. So I do have just a disclaimer. So all the information that I'm going to talk about, nothing is legal here, so please don't take this as legal advice or actual medical advice. I'm not an attorney. I don't play one on television. So, so if you have any legal questions, please talk to legal personnel, or even if you have medical questions, please talk to medical personnel. Okay. So just to start off, some of you here may very well know what a healthcare proxy is, what living will is, what advanced directive means. Some of you may already have those, which is great. Some of you may not know what those are, and some of you may fall somewhere in between. You know what they are, but you've been waiting to complete them, or you're not quite sure. Some things sometimes run together, and you're not sure if they're the same thing. So I'm hoping today that by the time we're finished, that everybody's going to have a clearer understanding of what an advanced directive is. And I know that you guys are probably going to have some questions. If you can, maybe hold on till the very end, and then that way we can talk about them together. So maybe try to write them down so that you remember what they are, because chances are if you have a question, somebody else is probably thinking the very same thing. All right, so let's get started here. All right, so advanced healthcare directives. So what exactly is an advanced healthcare directive? So an advanced healthcare directive is really basically you naming somebody to make a decision for you if you are ever in a position where you can't make a decision for yourself or you can't communicate your decision. So advanced directives, there are several things that can fall under that umbrella, but today I'm going to focus on two specific things. One of them is a healthcare proxy. You may also have heard it referred to as a healthcare agent. I'm going to talk about that first. And then I'm going to talk about a living will. And while you can have these separately, you don't have to have a living will if you have a healthcare proxy. If you have a healthcare proxy, that may be all you have. But the best way that these two work for you, they work together. So while you don't have to have them, the best thing for you is that you do have them together because they do very different things. All right, so let's get started with the first one. So a healthcare proxy. A healthcare proxy is actually the form, and you can see it right here. The form is what you use to fill out information. The agent is actually the person who makes the decisions that you have listed on the healthcare proxy form. So sometimes you hear that term healthcare agent, healthcare proxy used interchangeably, but the form is actually the proxy and the person is actually called the agent. Healthcare proxy forms, you can find those on several different websites. You can find them hopefully in your physician's office. If you have a specialty physician, you can find them in their office. There are some here, which I'll just show you. Matt handed me this copy, so there's some here. If you would like one afterwards. This one actually came from the Massachusetts.gov website. Hold it right up, so that's this one right here. So you may find this on several different websites. The form stylistically may look different depending on where you have got that form from, but the content is always the same. The questions may be rearranged differently or asked in a different way, but the content is always the same. It doesn't matter where you pull that from. All right. The other thing to know about this, what's important to know, is the healthcare proxy is for medical decisions only. has nothing to do with finances. A lot of people seem to think that it does have something to do with finances, so that may maybe prevent them from completing a healthcare proxy, but it has nothing to do with finances. It's healthcare only, and it also enables the person that you have named to be able to sign an individual into a long-term care facility, a nursing facility, if that needs to happen. So medical decisions only, as well as being able to sign a person into a long-term facility. Okay, so I'm going to go through each section here for you guys pretty quickly. Hopefully, I know the print is small, but so I have highlighted it so that you can hopefully see a little bit better. So the first part of the healthcare proxy is really simple. What you do is you would put your name. I can read this from here actually, I don't have to go over there. So you would put your name. So I'm going to use me as an example. So I, Traci Cucinotta, and I would write my address. Appoint the following person to be my healthcare agent with the authority to make healthcare decisions, again, only healthcare related, on my behalf. The authority becomes effective if the attending physician, this is the key part, determines in writing that I lack the capacity to make or communicate healthcare decisions myself. So very simple. So you would put in your name and your address right there. That's what starts it. The next form, the next part of the form is my healthcare agent is. So this is the person that you have chosen to represent you, to talk for you if you are no longer able to talk for yourself, if you're no longer able to make decisions or communicate decisions. So this part becomes very important, and I'm going to talk about that a little more in detail in a few minutes. But whoever you choose, this is who you're going to pick, and this is where you're going to put it. So for me, I have a healthcare proxy, and it's my husband. So on that section, it says Rio Cucinotta, address in Winthrop, and then where he can be reached. So he is my healthcare proxy agent. The next section is a section where you can name an alternate. Now, an alternate would be somebody who would fill in, who would take the place of the primary person that you have listed if the primary person cannot fulfill that role. And there are a couple different reasons why the primary person may not be able to do that. They may not be able to do it if they're no longer living. So then the alternate would come in. They may not be able to do it if they can't be reached. So if someone is out of the country, if someone is hiking in Uganda, it would probably be a little difficult to get in touch with them. So then the alternate would be the person that they would reach out to. If someone that you've listed maybe has developed dementia and they can no longer make decisions, then that is who the alternate would become then. You do not have to complete that section in order for the healthcare proxy form to be completed and to be legal. That's optional. Some people do put someone down, other people choose not to put anyone down. So that is an optional portion. All right, the next section is my healthcare agent's authority. So this is very important because this is stating the authority that your healthcare agent who you have named actually has. And it says, I give my healthcare agent, so in my case it's my husband, the same authority that I have to make any and all healthcare decisions, choices, values, and beliefs if known. And that's the key right there, those two words, if known. And if not known, then in my best interest. I give my healthcare agent the same rights that I have to use and to disclose my healthcare information. Medical records is governed by the health insurance, by HIPAA. And so your healthcare agent is going to be able to get the same information that you would get, have the same conversations with physicians that you would have. They're going to have access to everything that you would have access to because, again, they are taking the place of you. They are the one who's going to be making decisions for you. All right, the next section is where you sign it. So right here, you just sign your name and you date it. Very simple. And then the next area is equally important. So here's where you have to have your healthcare proxy witnessed. It has to be witnessed by 2 people. It can be witnessed by anybody that you want, with the exception of it cannot be witnessed by the person that you've named as the agent. It cannot be witnessed by the person as the alternate. And it also cannot be witnessed by anyone younger than 18. So you would want somebody who is at least 18 to be the witness. And the next little area there at the bottom is an area for the actual healthcare agent, the person that you've listed, to sign as well. And again, this section is also optional. They do not have to sign that in order for it to be a completed legal document. It's nice if you can have them sign it. One, it states that they do know that they've been named, and if that's the case, then hopefully you've had some conversations with them. But again, that's optional. That also does not need to be completed to make it a full legal completed document. So who can you name as your healthcare proxy? It's totally up to you. You can name anybody that you want to name, with the exception of the person, again, has to be 18 or older. And if you are in a hospital or you live in a nursing facility, you cannot name an employee unless the person is related to you by marriage, by blood, or by adoption. Then you could name somebody who possibly works in the facility where you're at. But otherwise, that cannot be who you pick as your healthcare proxy. All right, moving on. So a healthcare proxy, so what exactly is a healthcare proxy? So these are a couple of things that I have pulled out just to make note of that are important. So a healthcare proxy is a legally binding document. It just needs to be completed, it's a legally binding document. It just needs to be completed as directed. It needs to be signed and it needs to be witnessed by 2 people. Again, not the person that you've named or the alternate. And you don't need an attorney to complete the document. It's a legal document, but you don't need to have someone in the legal profession to complete it. You can, certainly, but you don't need to. And what actually makes it legal is once it's signed and then witnessed. So that is a very important part of it. So again, it has to be signed, it has to be witnessed, and it has to be dated. That's also important. So I have seen in the hospital a lot of times healthcare proxies have been completed, but there's not a date on it. And so, and then there's some question as to whether or not they can use it. So just make sure that when you do it, that is actually also dated. So just keep in mind it's a legal document. Okay, so healthcare proxy represents you. So in the section that is highlighted, that's where I talked a little bit earlier about how the person that you are choosing is going to have that power, that ability to make decisions for you. So it becomes very important that the person that you pick is somebody that you're familiar with, somebody that you trust. This person that you have chosen is going to make medical decisions for you if you're not able to make them or if you're not able to communicate them. And they're going to make decisions based upon what they believe you would or would not want done in a specific medical situation. If not, if they don't know, then they're going to make a decision based in the best interest of you. And when it comes to that scenario, if they don't know what you would choose, and if they have to make a decision what's in the best interest, then they're going to have the medical team to work with who will also be guiding them in the issues and what decisions would be in your best interest. Excuse me. They're going to make decisions based on your values, not on theirs, but on yours, based on what you want, what you believe, not what it is that they believe. So that's very important when you are choosing that person. All right, can you change it? Absolutely, you can change it anytime. You can update it as often as you want to. You can change it if the agent that you have picked changes, it moves. If their address changes, then you can update it then. You would want to make sure that the current agent's address and phone number is listed. so that it would be easy for a medical provider to be able to get in touch with them. You can change it if you decide that you just want somebody different to be your healthcare agent. You can change it by letting a medical provider know that I no longer want that person to be my healthcare agent. You can change it by ripping it up. You can change it by writing on a piece of paper, I no longer want whoever you've chosen to be the healthcare agent. You can do it verbally if you just say that. That changes the healthcare proxy right there. But remember, if you do a new one, then all you need to do is make sure that copies have been given to the people who you have given the previous copies to. So that would be your medical provider, the agent, and then a couple of other copies as well. The other thing that's important to know here is, I have the date circled, and that's because if you happen to have multiple healthcare proxies, then what happens is the one that has the most current date is the one that becomes effective. So that's the one that a medical team is going to look at. That's why it's important to have that date there. So if you have multiple copies, then they're going to look at the one that is the most current. Also, the best time to change it is when a person still has the capacity to change it. If a person no longer has the capacity to pick a person or to recognize a person who they would want, then that's not the time that it can be changed. So the time to change it is while a person still has the capacity to name somebody. All right. So the healthcare proxy, something that is important to know, and I don't know if some people know this, but you own this document. It's yours. The hospital doesn't own it. The physician doesn't own it. Nobody else owns this. This document is yours and yours alone. You own it. You're the one who has the power, and that's what this piece of paper is. This piece of paper right here is actually power that you are handing off to somebody else, giving them the authority to make decisions for you. So because of that, again, whoever you choose, it needs to be somebody who is familiar with you, somebody that you trust, somebody, again, who's going to make treatment decisions based hopefully on conversations that they have had with you, and based on just what they know about you, what they know that you value, and what's important to you. All right, let me see here. So copies. So when you complete a healthcare proxy, naming your agent, copies need to go. You need to have several copies. We like to say 4 copies is a good number to have. So the first thing is the original goes to you. A copy is as good as the original, but the original you should retain. You want to make sure that the person that you have listed as your healthcare agent actually receives a copy. Your doctor, so your primary care office, needs to have a copy. I know working in a hospital, a lot of times when a person comes in and there's not a copy of a healthcare proxy in their chart, the first person that usually gets called will be the primary care doctor to see if they have a copy of the healthcare proxy. So your primary care doctor, if you have any specialty physicians such as a cardiologist or a pulmonologist, then they would also need to have copies as well. You want to make sure that you give copies to your family, that everybody knows clearly who has been named as the healthcare agent. So friends, clergy, you could give them copies, and then anybody else that you want to give copies to. And what's important is that you keep a list of the people that you've given copies to, because if you update it, then you also want to give the updated forms to the individual people as well. Main thing to remember here, though, is that a copy is as good as the original. Okay.
Thank you.
Mm-hmm. So, can a healthcare proxy be revoked? Yes, it can be. So, if it is, it's valid until the healthcare proxy, this piece of paper right here, this form, is valid until you sign a new one. Remember I said, so the most current date is the one that's not, the one that they go by. If you legally separate, or if you have a divorce, then your spouse, who was named your agent, then no longer becomes your agent. If you verbally notify your agent, your doctor, or your healthcare provider, orally or in written, as I had said a few minutes ago, that you want to revoke your healthcare proxy, then that makes this one no longer valid. Or, as I had said, if you do anything else that clearly shows the medical provider that you no longer want the person that you have chosen to be the healthcare proxy, then that no longer makes this one valid as well. So it's easy to change, like I said, if you decide that you don't want the person that you have named. You know, maybe you've named your best friend, and then years later, you're not best friends anymore, so maybe you don't want her to be the person to make decisions for you. So it's easy to change. Okay, so just a couple of things just to wrap this section up, to remember that the healthcare proxy is actually a form of an advanced medical directive. It is for medical decisions only. Again, no other decisions, nothing financial, but all medical decisions. It authorizes the person that you have named to make all of the treatment decisions, or it can also limit authority. If you have, and actually I'll go back and show you on the will, I'll show you this, but you can actually limit the authority of the healthcare agent as well. The healthcare proxy is activated when the principal, who is actually you, the agent, not the agent, but you are known as the principal. So it's activated, it's not activated until you have been rendered incapable of making decisions. And the only way that that can happen is if a physician writes in your chart that you no longer have the capacity to make medical decisions for yourself. That's the only way that it can be activated. It has to be in writing, and it has to be documented in your chart. So let's say that you've named somebody as your healthcare agent, and you're in the hospital, and your healthcare agent sees that as an opportunity to talk to the doctor and just say, you know what, my grandmother has decided that she's no longer going to shower. She just doesn't want to do that anymore. So I think that we need to be able to make decisions for her. So the healthcare proxy should be put in place. So that's not how it works. The physician, as I said, needs to be the one to determine that a person no longer has that ability to make medical decisions. Because we all have the right to make decisions that aren't that good for us. I mean, if you don't want to take a shower anymore, that's your own personal decision, but wouldn't necessarily be the reason to invoke a healthcare proxy. Also, there is a section, let me go backwards just a minute, because I want to show you something that I did not show you. Okay, so this section that I highlighted right here, so this is where you're giving the agent authority to make decisions, but there's also a section in here that says, I give my healthcare agent the same authority that I have to make any and all healthcare decisions, including life-sustaining treatment decisions, except. And then you can actually list the limitations that you want to give to your healthcare agent. So you may say that your healthcare agent, you give them the authority to make all medical decisions for you, with the exception of CPR. You don't want them to be able to decide if the physician should or should not perform CPR. That's just an example. So if there is some power that you do not want to give over to your healthcare proxy, you would just simply fill it in right there as well. All right, so let's go to the second part. And this is, I'm going to talk a little bit about living wills. Now, as I said in the beginning, a healthcare proxy and a living will work best when they work together. A living will is not a replacement for a healthcare proxy. It's a totally separate entity. It's something that you do very differently. But a living will is actually where you capture all of the choices that you would want your healthcare agent to make on your behalf. So this is where you are going to list the types of treatments that you would or would not want done, or what would be important to you as if you have a medical issue progresses. So living wills actually did not come around until the mid-60s, and they came about because medical technology was advancing, and because of that advancement, also people were living longer, and so there were more individuals with long-term illnesses, and as well as memory loss, as well as dementias. So as those increased, as medical technology increased, then what happened was there became a need for decisions to be made for illnesses that people had that they continued to live with. Whereas prior to that, when medical technology was not as advanced as it is today, people didn't live as long as they did. There are a couple of other things that can fall under a living will, and I'll talk about them in just a minute. I'll briefly mention them. But a living will was first recognized as a legal document in the mid-70s in California. That was the very first state to recognize a living will as a legal document. Now, what's important here, I have to say up front, is that in Massachusetts, a living will is not recognized. I believe Massachusetts is one of 3 states that does not recognize a living will. So you may be thinking, well then why in the world would I want to do one if it's not going to be recognized, okay? Well, the answer to that is it still has the potential to help guide your healthcare agent and your medical team, because a living will, again, is where you're going to list things that are important to you, things that matter the most, again, choices that you would or would not want, particularly with end-of-life care. So while it may not be recognized in Massachusetts, it's still very functional in that it's going to help guide your medical team and your healthcare agent when they're making decisions on your behalf. Okay, so a living will. So a living will, you may not complete a living will in one day or in one setting, because a living will is where you want to take the time and the opportunity to really think through things before you write them down. So this is where you're really going to want to think about what's important to you. This is where you're going to make specific, let me just pull all these up so I can talk about these. This is where you're going to state very specifics about medical care and medical treatment that you would or would not want. It's about sitting and thinking that if you have a terminal illness, a long-term chronic illness, that at some point this illness may be the cause of death, and it may bring about certain issues, and those issues are certainly things that you'll want to talk about with your healthcare team. But this is really where you're going to want to state specific wishes for medical treatment. A lot of, we've probably all heard stories of people who have been in a situation where an end-of-life decision needs to be made, but families are sometimes not in agreement with that decision. So we've all heard stories about the chaos and confusion and disagreement and problems that come along with that. And by having completed a living will and having, again, captured all of that on paper, what happens is it gives, again, a guidance for people to know exactly what you would or would not want done. Because if that's not written down, then what happens is the end of life with a person that almost always revolves around making a decision about removing from life-sustaining treatment, it prevents the family from spending the final stages of life with their loved one. And instead what they're doing is they're in their little group over here and they are going back and forth about what this person would or would not want done. So it's very important that the person and your family has some idea of the things that were important to you. I like to tell people it's not about how you die, it's about how you live. So a lot of people think, how do I want to die? It's really not about that. It's about how do I want to live in that process as the disease that I have continues to progress. How do I want to live? So a couple of other things. You want to address, these are the things where you really want to talk about and think about specifics of end-of-life care decisions. So you want to think about values. What is it that you value in life? What's important to you? What's been the most important thing over the course of your life that has helped guide your decision making? Quality of life. How do you define quality of life? What is it that gives you quality of life? What's important to you? Some people, for my mother, quality of life is being able to spend time with her grandchildren. For some people, quality of life can be very simple. It can be as simple as I know someone who had a parent and said that their parent considered quality of life being able to eat chocolate ice cream. So that's something that person really wanted to be able to do, but if they were in a situation where they were no longer going to be able to actually eat food, to taste food, where they were going to have food through a feeding tube, then that's something that you would want to take into consideration. So it can be something simple, it can be something, that is more important, but it's an individual decision. That's the important thing to remember, is that quality of life is an individual decision. A lot of times, people are in agreement that end-of-life care needs to be talked about, but they still don't. So studies showed us, statistics showed us that more than half of Americans have not completed any type of an advance directive, whether it be a healthcare proxy or a living will. So even though we hear these stories about families that get into arguments at the end of life, we hear those, we think it's important to have conversations and to have documentation, but we still don't do that. And in light of that, what we like to also ask is some of the things that you value in life. So how about independence? Is that something that you would value, that would be very important to you to be able to maintain independence? It may not be full independence. Maybe it is just having somebody to come in and help you with certain things. But how important is your independence? And I think for most people, that's the most important thing for us. We all like to think about that we all want to be independent and self-sufficient. That's another thing that people typically value in life, being able to be self-sufficient, to do things for yourself, to not necessarily have to be helped in a lot of areas of life. So those are things that you want to consider. As you get older, it's important to continue to have those conversations, because for me today, I think about things, what I value and what's quality of life for me is different now than when it was 25 years ago for me. And it will probably be very different in another 10 years. So it's important when you're looking at making a living will, capturing these things that are important to you, that you review them and you revisit them regularly on a yearly basis, because things happen in life where we change our decisions. We change what we would or would not want to do. So it's important to revisit those as well. Living will is where you're going to really start to think about the types of treatments that you would or would not want to extend your life in any situation. This is where I said, you may not complete a living will in one setting. It may take some time for you to sit down and really think through these, because you're going to have to think through situations that sometimes are not easy for people and they're not comfortable, particularly when you're going to have conversations about them with your family. And a lot of people are very uneasy with that. But again, by completing a living will, you're giving somebody the guidance to make those decisions for you. Because it's very difficult for a person, it's almost impossible for a person to make end-of-life decisions for somebody that they've never had that conversation with. It's very difficult. So again, it's so important to make sure that the person that you have chosen and your family or your friends have something written down to help them in that process. So you want to think about things for treatment to extend your life. Would you want that in any situation? Would you want that in all situations? Would you want that only if a cure is possible? Those are the types of things that you would want to think about with end-of-life treatment and how it would extend your life. You want to think about things such as CPR. Would you want CPR? And do you even know what that entails? Cardiopulmonary resuscitation, if you go into cardiac arrest. What is involved with CPR? It's a procedure that can be very violent when a person is trying to restart your heart. And mechanical ventilation. If you are no longer able to breathe, would you want a machine to breathe for you? And what does that involve? Dialysis. Would you want dialysis in a situation? Tube feeding. How do you feel about tube feeding? If you're no longer able to eat, would you want to receive nutrition and hydration through a feeding tube? And pain management. This is one that is not always talked about, but it's important. So pain management, how would you want your pain managed? Would you want to not be in pain, but that may mean that you are not alert, not awake to spend time with your family? Or would you choose to have less pain medication so that you can be aware that your family's around and alert enough to talk with them? All right. So when we talk about a living will, advanced directives, there are several things that are out that you can use to capture your choices, your values, what you like and not, what you would or would not want. One of these is called 5 Wishes, and it's really simple. It's exactly what it says it is. It's 5 wishes. So you would fill this out. There's each page that asks one simple question, and then it gives you choices to circle, and then also write-ins. You can write things in as well. So this one is going to ask questions such as, first of all, it's going to ask who do you want to make decisions for you if you can't, the kind of medical treatment that you would or would not want, how comfortable that you want to be. That goes back to the pain management, along with some other things. How do I want people to treat me? And this is the one I love. It's the last one, and it says, what do I want my loved ones to know? So that is one type of advanced directive. There's another one. This one is called the conversation. And this one actually, I may have a copy of some of these. Some of these were locally put together. This one right here, the Conversation Project. I believe this one actually was started at Mass General. And it's all about having a conversation. It's about how do I even start having this really difficult conversation with somebody on end of life, because nobody likes to talk about that, right? It's a hard subject. Nobody wants to talk about that. So this one is really good because it shows you how to even start having that conversation. The other one is called Honoring Choices. This is also a Massachusetts advanced directive that was created. And in this one, you can name your agent, but then also it's about, again, you would list your choices of things that you would or would not want. So all of these, again, very similar to the healthcare proxy form, capture the same information, they just do it in different ways right there. Okay. All right, so this is my favorite. I saw this and I thought, oh, I have to put this up. So sometimes later becomes never. Do it now. And it's really important to think through this and to do it. You may not be able to complete it in one day, and that's okay. But what happens is the majority of people in life actually know what it is that they will die from. So there are outliers, people who have died in automobile accidents or some type of an accident, they pass away. But actually the majority of people know what it is that they will eventually die from. And I looked this up this morning because I wanted to make sure that got all of the information on this. And I had looked up the top 5 causes of death, and they are heart disease, cancer, lung disease, dementia. So those are some of the top reasons that people die. Those are the top illnesses that people die from. So I like to think that if we know what the cause of death is going to be, to think about that responsibly, and then to make plans for that. So, you know, we all like to think that we're going to live a long life, and I see in the hospital and in other situations all the time young people who thought that as well, and we just don't ever know what life has in store. And so for me, I did a healthcare proxy, and I suggested very heavily that my husband do a healthcare proxy probably 10 years ago, and so we have one. And because we just don't know what life is going to bring. And if you don't have something in place, then somebody is going to be put into a really stressful situation that's made difficult by what's happening and what's going on, but even more difficult because somebody's going to be looking to you to guide them on decisions. So it's important that you think through these things thoughtfully, responsibly, and then make a choice to sit down, to think about this stuff, to talk about it with somebody, and then to capture all of this on a piece of paper so that it can be used and there can be no questions as to how you would want the end of your life to proceed, to progress, and what decisions that you would or would not want. All right, and I think that's it. So thank you very much, and if there are any questions that I can answer, I would love to. There are some copies up here of healthcare proxy, of some of the living wills that we talked about. So if anybody, feel free to come and take some copies. If you have any questions, I'd be more than willing to help you. If you have questions about things like CPR and ventilation, things like that, I would be more than willing and happy to talk about you, you know, maybe on the side. But thank you. I appreciate any questions.
It was excellent.
Oh, good. Thank you. All right. Thank you so much.